we can connect with you and provide all the latest updates related to diabetes and its complications. Now, not only on a daily basis we post the content for you, but for you, we invite leading doctors from across the country who can talk to you directly as a friend. I'm very glad to welcome Dr. Navneet Agarwal from the city of Jhansi today. Sir, welcome to the program.
Thank you.
So today, sir, we will be talking about something for which we get a lot of questions, and people keep on putting this in chats as they hear us. That family history of diabetes is one of the big reasons of people catching diabetes. And if someone has a family history, then what needs to be done? But for all my viewers, before I start taking your questions, let me formally introduce Dr. Navneet to all of you. He is one of the most senior diabetologists in our country and serving his patients in the field of diabetes for last 4 decades now. He has been also the head of department. He has been serving there at Jhansi in the Rani Lakshmibai Medical College as head of department in medicine department and has more than 200 publications and research papers to his credit. Actively, sir is engaged in not only educating his peers, physicians on the advancement of diabetes, but also communities awareness programs as well. Sir, let me straight away, invite you and hand over the stage to you for your opening comments on this subject. And फिर हम सवाल लेंगे sir.
Okay. So the question is, or the title is that what if I have a family history of diabetes? Well, one straight answer is don't worry, because almost all the diseases lifestyle diseases that we deal with, say for instance, hypertension, diabetes, obesity, all have a family history. And therefore, the important thing to remember is that though we have a risk because of our genetic predisposition, but that risk can be mitigated to a very large extent by proper counseling and, of course, changes in our lifestyle. Remember that 50 years ago, diabetes was not such a big disease as it is today. So, what has changed? Our genes have not changed, our lifestyle has changed, and because of this lifestyle we constantly see an increase in diabetes, blood pressure, say obesity. So if this epidemic is there, why not we change this epidemic or these environmental factors so that we can mitigate or we can improve to a very large extent our blood glucose levels.
Yeah, I think this is very, very interesting points from you, sir, in the opening comments. Now, you mentioned about that how environment has changed, how lifestyle factors have changed in majority of population in our country. But even before I come on to those things, if you can help us explain that how does family history actually impacts the likelihood of developing the diabetes? Is it really a major risk factor which one should be careful about?
Yes. Now, whenever we say that a particular disease has a familial or a genetic component, the best studies are done on monozygotic twins. Now, why do I say that the best studies are done on monozygotic? Monozygotic twin means that you have an egg, you have a sperm, it is fertilized, and after fertilization, it breaks into two. So that two individuals are produced from the same genetic background. So, whenever we say that a disease has a genetic background or a familial background, we look at monozygotic twins, whether this disease is present in these monozygotic twins or not. Ideally, it should be present 100% if genes are so important. But luckily, for most of the disorders, the incidence rate is not 100%, luckily. Now, for instance, we have two types of diabetes, type 1 and type 2. Now, in type 1 diabetes, which is a diabetes of the young, say 5 to 25 years old persons developing diabetes, where we have the insulin mass as almost reduced to zero, there the concordance rate in a monozygotic twin is not more than 30 to 40%. That is, if we have 100 twin pairs of monozygotic twins, then not more than 30 of them would develop diabetes. In type 2 diabetes, which is the more common and which we see every day in our family members, parents, in our relatives, the concordance rate is close to 70 to 90%. So the familial or genetic component in type 2 diabetes is much more pronounced as regards to type 1 diabetes. But there is one advantage in type 2 diabetes, and that is that even though you have the genetic predisposition, you will not develop diabetes unless you rope in some environmental factors like obesity, physical inactivity, and improper diet.
All right. So, as you said that type 1 diabetes may the chances of the family history and genetic disposition impacting are lesser, significantly lesser as compared to type 2 diabetes, which we
Yes.
commonly see in our ecosystem. So when we talk about family history, so what all are included in family? Is it only the parents? One should be looking at कि my mother को या father को diabetes है तो मेरे को भी होगी, या a family is a much larger unit. Can you help us understand
Yes.
that?
Now, we have what is called as a first degree relative. And the first degree relative means our parents and our siblings. Siblings mean both male and female. See, diabetes does not spare a male sibling or a female sibling. It is almost present equally. So these are called as first degree relatives. The second degree relatives are our grandparents and uncle, aunties, and whatnot. So they are related to us, but the relation is slightly away. And finally, we have a third degree relative, or a third. By the time you reach to third degree relative, the risk is almost zero. But there is a variety of diabetes in which is called as a monogenic diabetes, in which there is a single gene defect, and which tends to be passed from grandfather to son and to grandson. So in that variety, which is luckily rare, one not more than 1%, where there is a single gene defect, there of course the relation from grandfather father is very clear cut, and you have a 3 generation diabetes.
Okay, so I think first degree relatives are अगर उनमें अगर diabetes अगर है, so then one needs to be more cautious. I think that's the biggest group one should be looking for, as you explained, sir. I have another question which may not be scientifically very qualified, but from a common man's perspective, I want to understand. जैसे आपने बताया कि डायबिटीज एक तो फैमिली हिस्ट्री है, उसके रिस्क फैक्टर्स हैं, एंड देन देयर आर एनवायरमेंटल फैक्टर्स आल्सो, लाइफस्टाइल फैक्टर्स एंड मल्टीपल थिंग्स. So in all the risk factors put together, how significant or what percentage would you attribute to family history, which cannot be changed, and how much percentage you attribute to the other modifiable risk factors?
Well, let me talk of both type 1 and type 2. I think my audience understands what is the difference between type 1 and type 2, or do I need to elaborate?
You can still, sir, आप एक बार अगर
एक बार और
basic
बता
difference बता दें जी.
Okay. Okay, then I'll take about a couple of minutes, right? Now, type 1 diabetes is that diabetes that typically occurs in child, in persons more than 5 to 6 years of age, right up to 25 years of age, usually, but it can go up to 40s or even 50s. Now, the basic difference between type 1 and type 2. What is diabetes? Diabetes is hyperglycemia. It is increased level of glucose in blood because of relative or absolute deficiency of insulin. ये बड़े मोटे तौर पे इसकी एक डेफिनेशन है, ठीक है. It is a syndrome of hyperglycemia due to relative or absolute deficiency of insulin. In type 1 diabetes, insulin is produced by beta cells. The beta cell mass is destroyed 99%, and you have just 1% beta cell functioning mass, and which also over a period of several months or years almost becomes zero. In type 2 diabetes, initially there is a stage of insulin resistance which is compensated by increase in insulin secretion from the insulin mass, from the beta cell mass. But this gradually becomes less and less until the reduction is less than 25%, where you develop features of diabetes. So the primary event besides the genes, I mean genes to hai hi hai, besides the genetic, the environment is that you are born with insulin resistance. This resistance keeps on increasing till a certain age, and then it is coupled with a increase or a decrease in insulin secretion, which results in type 2 diabetes. Now the question is, what did you ask? What about the genetic background?
Yeah, so I wanted to understand that how much percentage you can attribute to family history, the genetic part, and how much to the other factors.
Now, coming to type 1 diabetes, type 1 diabetes is a genetic disorder, but the degree of genetic influence varies. And why it varies? Because there is some trigger, either environmental toxin or a virus or some change in the environment, which leads to activation of immunocytes, T cell and B cell, and they tend to destroy the beta cell. So there is a destruction of beta cells. There is a inflammatory state which destroys the beta cells until less than 5% are functioning, and this results in diabetes. Now, the amount of genetic influence vis-a-vis environmental influence is much less in type 1. Environmental is much more than genetic. In type 2 diabetes, on the other hand, the Asian population as compared to a Caucasian population is more insulin resistant. Now, what I mean by insulin resistance? What I mean is that there is plenty of insulin available in the body. But unfortunately, in people who are destined to become diabetic, this insulin is not able to do its primary work, that is, metabolizing glucose. There is a degree of resistance. Now, if there is a resistance, then the body tries to compensate by increasing insulin secretion. Now, if you have a beta cell mass from which insulin is being secreted to a particular extent, then gradually this beta cell mass will be exhausted. And once 3/4 of it or 2/3 of it is exhausted, there is a postprandial hyperglycemia followed by fasting hyperglycemia and then full-fledged diabetes. So environmental factors seem to play a much more important role in type 1 diabetes, some trigger. But they are also important in type 2 because by improving the environmental factors, you can today talk of curing diabetes. 5 साल पहले तक हम क्योर की बात नहीं करते थे, लेकिन आज हम बड़े फख्र के साथ कहते हैं कि अगर आपके पास पैसा हो और इंक्लिनेशन हो तो वी कैन क्योर योर टाइप 2 डायबिटीज.
Okay, so inclination is very important here, along with money, as he emphasized. But I think it's very important. I hope our viewers would have understood that one important thing, that yes, the basic question which we asked today is that if I have family history, then is it an important risk? So the answer to that is yes. In different types of diabetes, it can vary. बट इफ यू हैव फैमिली हिस्ट्री, अगर फर्स्ट डिग्री रिलेटिव्स में अगर है, तो आप भी रिस्क पर तो हैं और आपको थोड़ा ध्यान रखना पड़ेगा. सर, नाउ इफ if there are individuals who have this family history, what are the basic symptoms they should be watching out for, early symptoms, so that if they see those, so they know that there's some kind of a problem and they go and visit their doctor.
Right. So let me first differentiate between type 1 and type 2, right? Now, remember that in type 1 diabetes, there is an explosive onset. Suddenly, you will find that 3-4 दिन की हिस्ट्री मिलती है, and patients complain of polyuria, polydipsia, and polyphagia. Now the meaning is that the patient starts micturating a lot, passes lot of urine, drinks lot of water, and eats lot of food. Polydipsia means increased thirst. Polyuria means increased urine formation, and polyphagia means increase in food intake. Despite that, he continues to lose weight, and he by the time he is brought to a doctor, he's usually lean and thin. Now, in the onset is explosive. That is, the symptoms are there for not more than a week or 10 days or even 2 days. Sometimes some mothers are very sensitive and they bring their children even after 3 days of developing of these symptoms. However, in type 2 diabetes, the onset is quite subtle. And it is said that a period of almost 5 years elapses before a patient realizes that there is something wrong. And therefore, the symptoms in type 2 diabetes are late. And there is a big period called pre-diabetes where the blood glucose levels are higher than normal but lesser than the diabetes diagnosis. And in these individuals, the symptoms are very minimal. Occasionally, the patient will complain of burning in soles. He or she will complain of increased nocturnal urine. से पहले एक बार जाते थे, अब 2 बार जाने लगे हैं साहब. कोई खास बात नहीं है साहब, लेकिन ऐसा हमने नोटिस किया है. Then there would be increased superficial infections, particularly of the genitalia, 1 or 2 episodes of candidal balanitis, that is infection of the male genitalia or female genitalia. Then there would be some, say, ear problem, some nose problem, some dental problem, and these are mild to begin with. They do not take a big big episode. And sometimes people neglect, अरे ठीक है, ठीक हो जाएगा, कान में दर्द ही तो है, ठीक हो जाएगा, and it improves. ऐसा नहीं है कि वो ultimately खराबी होता है, वो improve कर जाता है. So the symptoms in type 2 diabetes are minimal to begin with. Over a period of 4 to 5 years, when the beta cell mass has exhausted itself, then there is a full-blown frank picture of diabetes, that is a blood glucose level fasting more than 126 and a postprandial, that is 2 hours after 75 gram of glucose, more than 200, a HbA1c of more than 6.5.
Okay. So these are the symptoms, which Dr. Navneet Agarwal has mentioned, and I think बहुत ही important है कि अगर रिस्क फैक्टर अगर आपको फैमिली हिस्ट्री का अगर है अगर, तो इन सिम्टम्स के बारे में थोड़ा सा कॉशियस रहें, और जैसे ये सिम्टम हो तो आप उसको डिले ना करें, जाके अपने डॉक्टर से मिलें, सो दैट ही इज एबल टू हेल्प यू इन द अर्लियर डेज ओनली. सर, डू यू ऑल्सो रिकमेंड एनीथिंग लाइक एनी स्क्रीनिंग काइंड ऑफ थिंग, जैसा आपने बताया कि लगभग 5 साल के बाद लोग आपके पास आते हैं और वो थोड़ा सा लाइटली लेते हैं. सो डू यू रिकमेंड दैट आफ्टर एनी पर्टिकुलर एज सम स्क्रीनिंग शुड बी डन, चाहे वो ब्लड शुगर की हो या फिर अगर कुछ ऑर्गन्स की अगर करनी अगर है, एनीथिंग यू रिकमेंड ऑन दैट?
Yes. Now, looking at this big asymptomatic period in type 2 diabetes, the WHO, the ADA has recommended certain guidelines, right? In those individuals who have a family history, who are obese, who are physically inactive, dictum is that after the age of 45 years, this is, remember, American study, but in India it would probably be, say, 35. You must get your blood glucose checked. Now, there are 3 ways in which you check for the blood glucose. One is a fasting blood glucose. Now, up to 100 milligram per deciliter, the fasting blood glucose is normal. Between 100 to 125, we call it impaired fasting, right? And or impaired fast, and more than 126, that is 7 millimoles, is frank diabetes. The second component is the postprandial, that is after 75 gram of glucose load. You diagnose diabetes on the basis of 3 things: fasting, postprandial, and an HbA1c of more than 6.5. So the postprandial, that is 2 hours after 75 gram of glucose load, the blood sugar should be less than 200, and it should be above 200. Then we label it as diabetes. Between 140 to 1 to 199, we call it impaired glucose tolerance, or IGT. Right? IFG, impaired fasting; IGT, impaired glucose, that is 2 hours after 7. Now, it is usually what we do is that this is a cumbersome process, right? If you ask a person to take 75 ग्राम of glucose, 2 घंटे बैठेगा, उसके बाद ब्लड शुगर होगा, इस कम्बर। तो लोग क्या करते हैं, to cut short the screening, after all it takes time and money, तो they talk of fasting भी खाली पेट आ जाओ, and they talk of a HbA1c of 6.5 and above. तो दो चीजें आपने टेस्ट कर ली, एक आपने फास्टिंग कर लिया और एक आपने HbA1c जो पिछले 3 महीने की एवरेज ब्लड ग्लूकोज बताता है. So if you have more than 6.5 and you have more than 126, we tend to omit the postprandial and we straight away diagnose him as diabetes or impaired fasting glucose.
जी. सो दो चीजें बताई सर ने बहुत इंपॉर्टेंट. पहली तो ये कि अगर आपको फैमिली हिस्ट्री है अगर डायबिटीज की, तो 35 की एज के बाद आप सालाना एक बार अपना स्क्रीनिंग टेस्ट, ब्लड शुगर के बेसिक टेस्ट जरूर कराएं. रिमेंबर, एट एन एज अबव 35. And secondly, he also shared with us ki on blood sugars ke what are the numbers, and if you are above those numbers, then you should meet your doctor. Sir, just one very simple thing also I will ask now. Now this patients, they have a risk already, right? So they should come to their doctor between that 100 to 125 में जब चल रहा है impaired glucose, they are in that stage. Or if it is, let's say, it has crossed 126 and they find through some lab testing. So when should the alarm bell ring?
No, the alarm bell should start ringing once both parents are diabetic. I have to emphasize to my patients, देखिए अगर आप दोनों पेरेंट्स डायबिटिक हैं तो बच्चे को मिठाई के प्रति एवर्जन पैदा करें. आइसक्रीम, फास्ट फूड, चॉकलेट जो हमारे यहाँ लड्डू बनते हैं और ये जो मिठाइयाँ हैं, इसको शुरू से ही बच्चे में ऐसी आदत डालें कि इसके प्रति उसका रुझान ना हो. तो this training must start from the very beginning, because if both parents are diabetic, then the risk of developing diabetes in the children is as high as 70 to 90%. 10 में से 9 बच्चे डायबिटिक हो जाएंगे, 10 में से 7 बच्चे डायबिटिक होंगे अगर एनवायरनमेंट प्रॉपर नहीं है. And this you can certainly reduce if you train your children appropriately. ट्रेनिंग क्या होनी चाहिए कि भाई फिजिकल एक्टिविटी बढ़नी चाहिए, increase in physical activity, and a less than जो आप नॉर्मल मीठा खाते हैं या नॉर्मल फास्ट फूड खाते हैं, नॉर्मल कोल्ड ड्रिंक पीते हैं, उसके प्रति हमें हमारा रुझान नहीं होना चाहिए. क्योंकि अल्टीमेटली अगर आप देखें तो गांव से शहर में आने में what are the changes? The changes have been primarily in the fast food. पिज्जा है, मैगी है, बर्गर है, ये 3 सबसे बड़े कल्प्रिट हैं खाने में, और कोल्ड ड्रिंक, चौथी चीज कोल्ड ड्रिंक. अब क्यों नहीं गवर्नमेंट बैन लगा पाती? रोजाना मैकडॉनल्ड्स खुलता है, रोजाना पिज्जा हट खुलता है. भाई ठीक है कि चाकू जो है वो काटने के भी काम आता है और पेट में घोंपने के भी काम आता है. इसका मतलब चाकू पे बैन थोड़ी लगा देंगे. वन कैन ऑलवेज आर्ग्यू दैट कि भाई आप क्यों खाते हैं, आपको किसी ने कहा है क्या जाने के खाने के लिए? लेकिन इनका एडवर्टाइजमेंट इतना पावरफुल होता है और इतना अट्रैक्टिव होता है. आइसक्रीम है, अब कौन सा बच्चा ऐसा है जो आइसक्रीम नहीं खाना चाहता, या कौन सा बड़ा भी, भैया बढ़िया आइसक्रीम दिखाई देगी, लपकते हैं लोग. तो डायबिटीज तो ठीक होने से रही. लेकिन अगर हम शुरू से ही इसके प्रति एवर्जन पैदा करें कि भाई ये ठीक नहीं है, ये खाने हमारे हैं ही नहीं. अगर आप ट्रेडिशनल इंडियन फूड देखें तो मोटा अनाज है ना, जो आज के दिन मोदी जी बहुत हल्ला मचाते हैं, भाई मोटा अनाज खाओ, मोटा अनाज खाओ, और दाल और सब्जी. चावल पता नहीं ये बंगाल से और मद्रास से चावल कहाँ से आ गया. नॉर्दर्न इंडिया में तो चावल था ही नहीं. दाल रोटी हमेशा क्या कहते हैं, दाल और रोटी. देयर इज नो चावल नॉर्थ में. साउथ में मैं मान लेता हूँ, ईस्ट में भी मैं मान लेता हूँ. लेकिन अगर आप दाल रोटी, अगर आप अपनी बेसिक डाइट पे जाएंगे तो you can control your diabetes to a very large extent.
Okay. So I think some very very strong statements here made by Dr. Navneet, and he recommends you that alarm bell should ring. अगर आपके फैमिली में है पेरेंट्स को उसी दिन से पहले दिन से सावधान हो जाए, बल्कि ये पेरेंट्स की शायद जिम्मेवारी बन जाती है कि अपने बच्चों को थोड़ा सा एवर्जन टेक्निक्स सिखाएं, मतलब इन इन सब जो फास्ट फूड और इन चीज़ों को लेके जो रहता है. So now, look, you cannot change your, family history, and you cannot even change your basic instincts toward, अगर कोई देखेगा इस तरीके का फूड, सो कहीं ना कहीं he would be there. और आप हमेशा उसको जीरो भी नहीं कर सकते. So there would be always some intake happening somewhere. Do you recommend, sir, some other strategies also, especially pertaining to other lifestyle measures or
Oh
exercise
yes.
or something, जिसकी वजह से थोड़ा सा प्रिवेंशन हो सके इन रिस्क फैक्टर्स वाले पेशेंट्स को, या फिर एटलीस्ट डिले कर सके ऑनसेट को डायबिटीज को?
Of course, there are so many measures. Primarily, they are two. One is increase in physical activity, and the other is change in the dietary habit. Right? Now, let me take one by one. Increase in physical activity. Most of us are sedentary. Right? हम लोग 7-8 घंटे ऑफिस में काम करते हैं, और आपसे कहा जाए कि यू मस्ट वॉक फॉर एटलीस्ट हाफ एन आवर एवरी डे फॉर 5 days इन अ वीक, तो उसमें जी चुराते हैं. अरे ठीक है, अब नींद आ रही है, अब कल चलेंगे और आज चलेंगे, इस तरह से घुमा फिरा के उसको डिले करते हैं. बट रिमेंबर दैट टू why is walking considered to be the best form of exercise? The reason is very simple. You don't require any expensive equipment. All you require is a sensible pair of shoes and an open space where you can go. And if you don't have an open space, then the wide open roads the government is making, you can always break them with your shoes. So minimum is half an hour, and the speed should be 10 minutes, 1 kilometer. So 1.5 kilometer going, 1.5 kilometer coming in 30 minutes for 5 days in a week is the standard recommendation for your physical activity. But that doesn't mean that you should restrict yourself to only 5 days in a week. Why not all 7 days in a week? That will be even better. Why only 30 minutes? You can take to 40 minutes, you can take to 45 minutes. Number one. Number two is that there are two types of exercises. One is aerobic and walking. For example, walking, running, cycling, dancing, swimming are aerobic exercises. The second is a muscle building exercise, and that means spring. पहले आपने बुलवर्कर किया होगा. I'm not sure whether you've done it or not. हमारे टाइम में, when I was in my 30s and 40s, बुलवर्कर बहुत कॉमन हुआ करता था. It was a spring, and you must, if you have used it, then you understand. So, a muscle building exercise is equally important to an aerobic exercise. हम लोग एरोबिक एक्सरसाइज को तो बहुत स्ट्रेस देते हैं बिकॉज वो कार्डियोवैस्कुलर फ्रेंडली है, लेकिन nowadays we understand that if our thigh muscles and our shoulder muscles are powerful, they can only be built not by walking. पैदल चलने से ये मसल बिल्डअप नहीं होंगी. You have to do some what is called as a resistance exercise. Either you have a dumbbell, एक डंबल उठाइए, एक 5 मिनट के लिए सवेरे शाम डंबल उठाते रहिए, or you have a spring that you hold the spring and you stretch it to your maximum capacity. So aerobic exercises and resistance exercises, and finally योग. Now I would like to take a couple of minutes. आपके पास टाइम है 2 मिनट का योग?
जरूर सर, प्लीज गो अहेड.
Now योग has come up in a very big way in Indian philosophy and in Indian doctors who understand yoga. The problem is that for far longer time योग was considered, जैसे कि इंडिया में बहुत सारी चीजें मम्बो जम्बो है, पता नहीं हमारा क्या यूज है, जबरदस्ती के हमें तंग करते हैं. तो बहुत सालों तक ये हमारे लिए एक वो रहा exotic sort of a exercise. But now that Mr. Modi has popularized yoga in all over the world, some studies were done in All India Institute of Sciences where they showed two clear things. One is that if you are doing yoga for diabetes or for prevention of diabetes, then you can then you can, ये मेरे full screen कर दीजिए. People are asking for a full screen. So can you do it full screen?
It is done, sir.
It is done. So there are two things that have come out. One is that doing 5 or 6 basic exercises. One is pranayam, that is putting one nostril and breathing in from one nostril and breathing out from the other. And the second is Kapalbhati, that is you push your stomach inside and then you leave it inside and leave it. Doing it for 5 minutes every day is very beneficial. And one is called as a Mandukasana, in which you put your finger like this, press it over the abdomen, and you flex your head. Now, this is supposed to stimulate the pancreas. I do not know, I have not done it, but Baba Ramdev goes and swears by a Mandukasana for diabetes. Well, in All India Institute, people said, one of the doctors in the institute said, that we left it to the patient कि भाई तुम्हें योग करना है और ये हम exercises बता रहे हैं, इन exercises के करने से तुम्हें फायदा होगा. Now after 6 months of doing that, और वो period था इसका कोरोना का, so they could not monitor them very well, but 2 results came out and they are very significant. The one result that came out was that there was no loss in weight. उन मरीजों का वेट बिल्कुल जैसा था वैसे बना रहा, मोटे थे तो मोटे थे, दुबले थे तो दुबले थे. But those patients who are of impaired glucose tolerance, a substantial number, 30 to 40%, became normal. Their blood glucose became normal. So even though Western science क्या कहती है, you lose weight and your diabetes will improve. Yogic science ये कहती है कि without reduction in weight, your blood glucose will improve if you do these exercises. So this conclusion, ये अभी एक paper publish हुआ है All India Institute से.
So you basically give it to give the credit to then higher insulin secretion or a better, or reduced resistance of insulin because of you.
You see, insulin resistance can only be reduced by loss of weight. If you don't lose weight, insulin resistance will remain the same. Probably either insulin secretion is there, we do not know. The biochemical studies were not done. It was only a clinical. You must understand it is very expensive to do a biochemical study. तो वो तो नहीं हुई, लेकिन improvement हुआ. So this is one benefit of yoga that I tend to tell my patients कि भाई अगर अच्छा, many of our patients have arthritis and backache, so they are unable to squat. So I tell them कि भाई कुर्सी पे बैठ के कर लो. कुर्सी पे बैठने में तो दिक्कत नहीं है. बोले नहीं साहब उसमें दिक्कत नहीं. तो अनुलोम विलोम ऐसे करने में कुर्सी पे बैठ के जैसे मैं बैठ रहा हूँ और मैं कर रहा हूँ, उसमें क्या दिक्कत है? For 5 minutes every day. And similarly Kapalbhati, pushing your abdomen inside and then exhaling, इसमें क्या दिक्कत है? So majority of them are very surprised कि साहब हम बैठ के भी कर सकते हैं. मैंने कहा क्या दिक्कत है, बैठ के करो. योग में ये थोड़ी है कि आपको बिल्कुल पालती मार के और प्रॉपरली करना. हम तो ये कहते हैं कि आप कुछ एक्सरसाइज करो.
Okay.
So this is
yeah. No, this is very, very important. I think what Dr. Navneet mentions. सबसे पहले तो ये कि अगर फैमिली हिस्ट्री है, रिस्क है डायबिटीज का, आप उसको सिग्निफिकेंटली उस रिस्क को कम कर सकते हैं अगर आप लाइफस्टाइल मेजर्स, एक्सरसाइज, इफ यू आर गुड ऑन दैट, आप डिले कर सकते हैं काफी ऑनसेट डायबिटीज का. और जहाँ एक्सरसाइज की बात आती है तो सर ने 3 चीजों के ऊपर इन्होंने फोकस किया कि आप एरोबिक एक्सरसाइज, चलना फिरना, दौड़ना, स्विमिंग करना, ये करें. दूसरा रेजिस्टेंस एक्सरसाइजेस भी करें, वेट उठाना या स्प्रिंग्स खींचना टू बिल्ड द मसल. एंड द थर्ड थिंग ही emphasizes on yoga as well, which will help you significantly. Now, thank you so very much for emphasizing on all these 3 things. Just in case you missed anything which he has said, good news for you is that this program will stay here on this link. आप पीछे जाके रिवाइंड करके वापस फिर से सुन सकते हैं डॉक्टर नवनीत को. सर एक आखिरी सवाल आपसे लेंगे since we are running out of time. Are there any latest advancements of science and technology as well? आपने बीच में मेंशन किया कि इसका रिवर्सल भी हो सकता है डायबिटीज का और काफी हद तक कुछ चीजें ठीक कर सकते हैं. Are there some new things in medical science which can help these patients जिनका फैमिली हिस्ट्री है और रिस्क हाई है, उनका रिस्क रिड्यूस किया जा सके या ऑनसेट सिग्निफिकेंटली डिले किया जा सके.
Now, you see, for type 2 diabetes, things are simple. You are overweight, you are obese, and you have a family history of diabetes, you have to lose weight, right? So then and there, then only you would be able to prevent or at least delay the onset of diabetes. The problem is type 1. Type 1 diabetes has an explosive onset. You only come to know type 1 diabetes when there is a full-blown picture of polyuria, polydipsia, and polyphagia. Now, how do we screen these patients? Problem ये है कि हम कौन से मरीजों को screen करें? Do we screen the first degree relatives of type 1 diabetes? The incidence of type 1 diabetes in a type 1 diabetic parent or both type 1 diabetic parents is just 6 to 8%. ये बहुत है ही नहीं. So it is infructuous. And what is the screening? The screening is antibody screening. That is GAD, insulin autoantibody, IA512, and then ZNT2 antibodies screening. This entire screen is costing 20,000 rupees or 15,000 rupees. So it is a hugely expensive exercise for any individual कि भाई मेरे पेरेंट्स डायबिटिक हैं टाइप 1, भाई मुझे भी हो सकती है. द इंसिडेंस इज सो लो दैट स्क्रीनिंग इज नॉट प्रेफर्ड. हाउएवर, जैसे स्कैंडिनेवियन कंट्रीज में, नॉर्वे में, स्वीडन में सबसे ज्यादा है टाइप 1 diabetes. Now in these Scandinavian countries, what they do is they screen for autoantibodies or insulin antibodies, and if more than 2 antibodies are present, say GAD65 or insulin antibody IA512, then they have said that a drug called teplizumab, it's a monoclonal antibody, when given for a certain period, can delay the onset of diabetes. Because once you have more than 2 antibodies, then your chances of developing type 1 diabetes goes up to 70 to 90%. So it is a very huge risk. Now, how do we screen in our resource poor country? That is the big question.
So there are a lot of scientific advancements which are available. It will be individualized as well. So it is always better to talk to your doctor and discuss these things and seek if there are any solutions. I think sir, आज हमने इस पूरे सब्जेक्ट के ऊपर of family history in diabetes, I think we covered it largely, and I must thank you for being so candid and kind in giving elaborate answers on each and everything. I hope हमारे viewers को this would have helped. All the questions related to this subject which came, we have taken them as well. Uh, I'll thank all my viewers as well who joined us live today, and those who will join us later on and watch this program and as it will stay here. अगर आपके फैमिली में या आपके फ्रेंड सर्कल में अगर इफ यू हैव एनी सच पीपल जिनकी फैमिली हिस्ट्री है डायबिटीज की, उनके घर में किसी को डायबिटीज है, तो आप इस प्रोग्राम का लिंक शेयर कर सकते हैं उनके साथ. और ये आज की जो डिस्कशन है और जो एडवाइस डॉक्टर नवनीत ने हमें दी, this can be very very helpful for those individuals, so help them out. And but before I conclude sir and say thank you to everyone, any final remarks from you or anything which you still want to emphasize which we may have missed?
See, diabetes is a exploding epidemic and there is no end in sight. Daily the numbers are increasing, and it is a tragedy that type 2 diabetes is a eminently preventable disease, not curable. It is an eminently preventable disease provided we go back to our basics. साइकिल चलाना बंद कर दिया, स्कूटर और कार पे दौड़ने लगे, स्ट्रेस जनरेट करते हैं, खाए खाए दौड़ते हैं. इतना भोजन जीवन में कभी नहीं था जितना कि आज के दिन है. हम लोग फास्टिंग जानते ही नहीं. मिडिल क्लास फैमिली में कभी ऐसा दिन नहीं गया होगा जब हमने 3 बार खाना ना खाया हो. तो अगर आप ये देखें तो ये हमारे शरीर के लिए ठीक नहीं है. और बॉडी इज मेंट टू, आप गधे घोड़े को देखते हैं, गाय भैंस को देखते हैं, 10 किलोमीटर पैदल चलती है, सूखी घास खाती है और चकाचक मोटी रहती है. आदमी एक अकेला ऐसा जानवर है जो कि बैठे बैठे खाना चाहता है. पहले उसको तलेगा, भूनेगा, उसमें नमक भरेगा, फिर उसमें चीनी भरेगा और बोलेगा आ हा हा मजा आ गया। अरे भाई, आइसक्रीम कोई खाने की चीज है? इतनी शुगर, इतनी 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 चीजें हैं, इज इट रियली वर्थवाइल आइटम टू ईट? तो अगर हम अपने आप को नहीं बदलेंगे तो इस एपिडेमिक से हम पार नहीं पा सकते। मोटा अनाज खाइए, एक्सरसाइज करिए, वॉकिंग करिए, साइकिलिंग करिए और अपने आप को स्ट्रेस से फ्री रखिए। ये सबसे बड़े मैसेज है मेरे मेरे द्वारा आपके लिए।
थैंक यू सो वेरी मच डॉक्टर नवनीत टुडे। आपने हमें, आई थिंक यू हैव बीन वेरी वेरी कैंडिड। आई मस्ट अप्रिशिएट आपने जिस तरीके से आज हमारे व्यूअर्स को बताया। और जैसे कि बताया सर ने, स्ट्रेस फ्री रहें। बिल्कुल खाना नहीं बंद कर सकते आइसक्रीम को या उन चीज़ों को, तो इस चीज़ की भी स्ट्रेस ना लें आप। ज़्यादा एक्सरसाइज की तरफ ध्यान दें और तीनों चीज़ें, रेजिस्टेंस एक्सरसाइज, एरोबिक और योगा पर भी ध्यान दें, एंड गो with his word. He's one of the senior most, diabetologist in our country. For more than 4 decades, he's serving thousands of patients, lakhs of patients he would have treated. I think every word which he has said comes out of this huge experience which he has. And we all must take benefit of his advice today. Thank you so very much, everyone. Dr. Namri, thank you so very much for joining us.
थैंक यू।
And I thank you. Good night. Good night, everyone.